All right, the health sector is crossing its fingers for some meaningful change with the government's annual budget just 3 days away. Despite last year's budget being called the health budget, in many ways, it seems to have missed the mark. Waitlists have got longer and pay negotiations, well, they're still going on. So to tell us what needs to be different this year, we're joined by health recruiter Prudence Thomson and from down the line, I think, a nurse of 40 years, Denise Moore, joining us from Christchurch this morning. Thank you to you both for your time. I'll start with you, Prudence. It was supposed to be a health budget last year, so how high or low are your hopes this year that things are going to look any better for the health sector?
Oh, look, my hopes are quite high that there'll be some injection into primary health, education and training New Zealand nurses, as well as supporting international nurses to come in.
Tangibly, what do you want to see? What was the failure with last year's health budget that hasn't changed the situation enough?
I think primary health, mental health, and again supporting students, getting nurses into training, paid nursing training, for goodness sake, get nurses into training, physios, OTs, speech therapists. We recruit heavily from overseas and we do rely on an overseas workforce. 62% of our doctors are overseas trained. That's not going to change in the immediate future, but I'd like to see an investment now into encouraging students into nursing.
It's hard though, isn't it? Because you're throwing money at things that you don't see an immediate return from.
Yeah, it will be years before there is an immediate return, especially training nurses to get up to be completely independent, working in the community. Mental health especially, and also primary health is super important, and GPs, supporting GPs in the community.
You talk about the number of staff that we have as migrants to this country, 60-odd% that we are bringing in. Should we not be focusing more on that training that you're talking about, or do you think that balance will always be in the 60-odd%?
I think so that's doctors, 60%, nurses about 32%, nurses from IQN, and the Nurses Council are really good at supporting nurses coming through. Immigration are making medical professionals a priority, which is great, but we do need to support nurses to get into studying, doctors, physios, etc., to get into studying so we don't rely on the overseas workforce.
How do you convince people that this is still an industry they should be going into in New Zealand?
Yeah, well, look, people come to New Zealand for the lifestyle.
But is it getting to be a harder sell? Our wages aren't great.
No, the wages aren't amazing, but a nurse with 5 years will start on 96,000, and with the overtime will get up to 120,000. So it's a livable wage in most cities. Auckland is a hard sell, and look, Te Whatu Ora, I think, are doing a good job in supporting relocation. As I said, immigration are fast-tracking residency through the green list, but we do sell on a lifestyle and we do sell on this beautiful country.